Peyronie's disease is an unfortunate condition that causes scar tissue to develop inside the penis. When this scar tissue develops, it prevents the penis from expanding when blood supply gets in to try to have an erection. That scar tissue can cause an abnormal shape of the penis, like a bend or an hourglass, and sometimes it can be painful. Unfortunately, we don't know what causes Peyronie's disease. There's some beliefs that it could be autoimmune. In other words, the body's attacking itself, almost like a rheumatoid arthritis or lupus. Some people think that it's due to trauma. In other words, a person has surgery. Let's pretend that they have prolonged back surgery. They need a catheter put in for 6 to 8 hours, and the catheter irritated something on the inside. Or there's direct trauma to the penis. In other words, a painful intercourse experience where the penis bends during intercourse, and then as that develops and the body tries to heal, unfortunately a scar develops, creating the plaque and the curve in the penis with pain. When the plaque develops and Peyronie's disease starts to really kick in, it creates a lot of problems for a man and his partner. So for the man, when plaques develop, it's going to cause an abnormal bend of the penis, an abnormal shape, and a lot of times pain will settle in. And so when you have an erection and it hurts, it's going to affect your sex life. Now for the partner, if the penis is bending in a certain direction, it's going to poke things, let's be honest. It's going to bump into the uterus. It's going to bump into sidewalls when it's not meant to do that, and it can be very painful for the partner during intercourse, making intercourse very uncomfortable and very unpleasant. Peyronie's disease can actually be self-diagnosed, because if you wake up one day and you have an erection that's curving to one side and it wasn't doing that the day before and it hurts down there, that's Peyronie's disease. Now, in my office, we'll assess you, we'll do an exam, we'll see if we can feel that plaque, and then we'll most likely have you follow up in the office to do an ultrasound of the penis to see if we can see that plaque under ultrasound. And when we do that ultrasound, a lot of times we're going to do a simple injection with a little itty-bitty needle to create an erection in the office, and we can see if that plaque looks different when the penis is fully engorged during an erection. There's a lot of treatments available for Peyronie's disease. It's been out and tried for decades. Unfortunately, historically, a lot of the treatments just don't work. But there are things like creams that could be ordered from a compounding pharmacy. There's injections with a medication called verapamil, which is actually an old-fashioned blood pressure medicine, and we can inject this into the penis. But newly, in the last few years, there's been a medication available called Xiaflex. Xiaflex is the only drug approved for the treatment of Peyronie's disease. It's a series of injections that take a long time to complete. In other words, there's round 1, which is 2 injections over a couple of days, and then there's round 2, which is usually 6 weeks later, and then it goes up to 4 rounds if we need to do that for the individual. And this is a medicine that is used to break down that plaque so that the tissue can expand better, take away the bend, and also help with the pain. How do we determine which treatment is right for the individual? Well, after we assess you in the office and we do our ultrasound to determine the plaque and the location, one, we're going to want to make sure that your pain is cycled through, because a lot of people will get some pain and then the pain will go away just as the disease progresses. Once that happens, we can start holistic approaches, just like vitamin E, coenzyme Q10, and even a daily Cialis or tadalafil to take at bedtime. And this just promotes healing, promotes blood supply to the body. If the problem is a little bit more pronounced, but the angle is not that bad, we can order topical creams. So there's an old-fashioned medicine called pentoxifylline. It could be applied to the penis. And what this does is it's just going to try to improve blood supply to the area and allow the area to heal. We'll even use a vacuum device. A vacuum device is a device that goes over the penis that will pull blood supply into the penis to try to straighten it, lengthen it, and soften the curve. Now, if the curve is so bad and the plaque is so dense, then it's time for XIAFLEX. XIAFLEX, like I mentioned before, is where you come into the office. It's a series of injections that take only a minute or two, and then there are exercises that the patient will do after the injection to promote healing, promote straightening, and reduce the curve. Now, if the situation is very bad, or if they've been through XIAFLEX and it didn't work, then there are surgical procedures to help straighten the penis or remove the plaque and put a new graft in to help straighten the penis. And in some cases, we actually have to talk about implant therapy to help improve the erection and straighten the penis out at the same time. So a common question is going to be, what if I don't do anything? Well, if you don't do anything, then you're going to continue to have a curved penis. If you have a curved penis and it is affecting your sex life, well then your sex life is over. I hate to say that, but that's true. If you may get lucky, and I mean you may get lucky, where this will just run its course and it'll just go away. But unfortunately, it's something that happens and it stays. And if it stays and you don't treat it, your sex life's going to be over, or at least it's going to be drastically different. And that's why we encourage men to come in, hear the options, talk about what we can do, allow us to do our testing so we can try to come up with a fix for this problem.